Hey, how you doing, guys? So this is Dr. Sai at Specific Chiropractic. In this video, we're going to talk about failed back surgery syndrome and sciatica going down your right leg over here. Okay, so now was it like 4 years ago? You had the back surgery.
Yes.
They operated it on that fifth lumbar disc, right?
Yes.
and beforehand, I believe you were in a wheelchair, right?
I was in a wheelchair, I was in a walker, I did physical therapy, I took all the medications, the gabapentins, all the stuff and I got tired, and so I was like, you know what, let me just get the surgery. And that helped until it didn't. Back in March, the pain has started all over again from my lower back all the way down to my right leg. I lose mobility all the time. I need help to get to the bathroom, just to get up, to get out of the car, to get out of bed. I can't sit for too long. If I sneeze, it like you feel the pain going down. You get sharp stabbing pains in the lower back and shooting up and down the right leg. And decided to just not deal with the pain anymore because it's been on and off. But this past month has been constant every day. There's like no day of rest. So I was like, this is it. I have to come here. I'm tired. I have work. I have a child. I can't just be stuck in this place. You know, like I need my freedom back to walk and move.
Gotcha. Out of curiosity, one part of the consultation we discussed about was that you also experienced some pain, not only radiating down your leg, but also it radiates to your groin.
Yes. So a couple of months back, I thought, you know, I was getting these sharp pains just like my back, but I never associated it to my lower back to the same thing. I'm like any woman would think, hey, go to the GYN, go to your doctor and get this exam. I mean, they've done all kinds of scans, blood work and everything. They find a cyst. It's so tiny that they're like, it can't be it. It's like the same sharp radiating pain. But again, as a woman, you think maybe these things are like menstrual or body or different because it's in the front area, and come to find out today it's all associated with the same thing, which is crazy because they couldn't find, and they still don't have an answer.
Yeah, so basically when I hear on the history regards that kind of pain pattern, that's typically a sacrum, okay, a sacrum pain pattern itself. So we're going to go over along with the viewers, take a look at the x-rays, examination, and we'll confirm that hunch. All right? Again, based on the history alone, we're talking about, okay, there's a potential sacral segment issue. And we could also see to the viewers here as well, okay, they operated on this fifth lumbar disc. Okay, it doesn't look like any of these other discs. Okay, so that's why the height is changed over here. But when I take a closer look over down these sacral segments, there is a posterior open wedge, a V shape right here. Okay, so I'm going to take a closer look on you during examination if this is the fellow that we need to address. Other things I do want to keep an eye on is the fact that, well, you've got this gluteal false shadow. It ideally should be smack in the middle, but it's over to the right. What I find interesting is that with this hip, it's supposed to be sticking down this way, but actually it's going this way. So it's sort of like driving a car, you turn that steering wheel to the right, but the car's going to the left. That doesn't make sense. That's kind of bizarre, right? So that's why I'm considering, possibly, you know, when they operated on this, it possibly altered the biomechanics. But, you know, we do see that this might be the issue still, the right hips, is because, well, the other thing is that you do have some arthritis here, okay? So it's a crisscross pattern because when the right hip itself, when you rotate it so much this way, well, you're not going to walk this way. The head, because it's two joints of the head, has to keep us centered and level as well. So in order to make that compensation, okay, over here on the left-hand side, you got to twist a lot to try to recenter the head. So that's why I see some arthritis over here, all right? And I also see that arthritis in your neck as well. So this is typically coming from an external rotated hip, and that's what we're seeing over here. But right now, okay, the way I saw in your walking gait and everything else, I believe we could triage this and address this second sacral segment first, And once it starts becoming healing up and stabilized, you may start experiencing a different type of low back pain coming from the rotation of this right hip. So don't be surprised when it says, yeah, I do feel a lot better, and then a couple of weeks down the road, or even a few months down the road, it says, well, what the hell's going on? I feel, like different type of pain, like the right hip's not aching up. It wasn't there before. Right. But actually, it's a very old problem. It's been there because that's how I got this degeneration here, and this degenerated arthritis over here as well. Right? So don't mind that, okay? I'm on it because like a chess grandmaster, I need to see things 10, 15 moves in advance and in the past in terms of what caused that disc to blow out in the first place, where you needed to be, in the wheelchair or the walker, and then you finally had to do surgery for that thing. So I believe that precipitated that fella. And since that wasn't properly addressed, that's why this one, like the final circuit breaker, it just tripped and blew out again. Okay. Yeah. Okay, so let's take a look, see what's going on with these two fellows over here, and then I'm going to investigate what's going on here, and especially that degenerated circle right there. Now, the next step process, what we want to do in the Gonstead method is visualization and inspection. I want to take a look for, is there any potential swelling or muscle spasms that's trying to stabilize and protect something? I do see a lot of it right over here, which comes no surprise. So we saw the x-ray with that degeneration over here. Take a look, trace through here. It's some swelling over here, not too bad. Some pitting edema here. But then when we come down here, okay, you viewers can see, okay, what's going on over here? There's a lot of swelling here. And we do see the surgical mark over here, but also, again, this is very swollen, okay? And we see it, this is bouncy, okay? This is not fat, okay? This is all liquid fluid, all the edema sinking down to here, and it's trying to stabilize and protect something here. So we start scanning with this instrument over here, help confirm some potential levels that warrants a closer investigation on you. That's one level. So see, this is what's interesting enough. So when we get down here, because they operate on it, see the nerve is starting to become chronic. We do have a small little reading, about 2 points to the right, at the 5th lumbar level. And then we scan a little bit more down. See, right at that 2S level right here. See, we have another reading to the right over here as well. So we have a reading from the degenerated disc. Left right there. Alright, now let's start testing some things. How's that right there? Yeah, I'm barely touching this, and you're already jumping. Okay, let's see how it moves. I'm just doing very gentle, so it won't aggravate too much. Left hip is moving. Right is somewhat stuck. Okay, now we're... Okay, I got it. Which one's really bad? The middle one right here? Or the right one?
Oh,
that's bad. Yeah. But which one's worse?
Oh.
The middle?
They're not friendly. They're not friendly.
I know they're not friendly right there. I need some feedback here. Which one's worse for you? The right side or the left side? I'm sorry, the right side or the middle?
It's how they both hurt. It's just.
I get it. But right now, it's not a happy camper at all. See, it's just not rotating there whatsoever. So this is going to be our candidate, that second sacral segment right there. See, the 5th lumbar, it's decent. It's kind of moving, but it's not too bad. So we'll leave that alone right there. Interesting enough, this is not too bad either. Right there. See, it's swollen right there. Right there, that 5th circle. Got it. Okay. No, Alexis, right here now. Okay. When you're ready, come on up.
Oh.
Go ahead, walk around when you're ready.
Oh. Couldn't walk. Oh, this feels so good. Yes. It's been weeks since I could walk. Oh, that feels good.
What else do you notice that's different?
I mean, like, all that nerve pain that was here is like gone. My leg, my shoulder feels more relaxed. My neck, slightly, like everything just feels more just relaxed. Like, usually trust me, I've gotten adjusted before. You feel slight, but you still feel that pressure. The pressure is gone. That pain that's like that. So the radiating, the stab, is just like gone.
So the sciatica's gone?
For now, I mean, like, I don't feel anything right now. I couldn't get up. I was struggling from here. You saw me when I walked in. I could barely walk to the bathroom. I could barely get out of a car. Like, I'm walking. Like, I'm literally walking. I'm I'm walking. Like, I'm excited. I haven't been able to work out. I haven't been able to do anything for days. Like, all of this, just all of that pressure is just gone. Like, gone. Like, that's, I guess that's why my boyfriend was stressing me to come here. He was like, go, go, go. Should have came sooner, because I was in pain for way too long. Way too long. Like, way too long. Like, wow. I'm just a little shocked right now, because I expected some relief, not like a lot of relief at the same time.
I'm glad, it's working out for you, getting a lot of relief, okay?
Yes.
So we'll tell you about the cold ice pack protocol afterwards, right? And then we'll take a look, see what's going on in the next couple of days, because I want to see how that thing's healing up.
Okay,
right?
I will let you know.
Right. I'll see you next time. Oh, you're welcome.